Hi, everyone. Really excited to be talking to you today about one of my favorite topics, which is strategic sourcing for impact, because I'm a bit of a sourcing buff. Now, I realize many of you may know that a diverse supplier base is crucial for the growth of your business. And I know that launching a supplier diversity program can be challenging anyway, especially when you don't have, a solid data foundation in place. You may not have accurate supplier information, let alone supplier diversity information necessary to correctly track what you spend with diverse companies. With all that in mind, we know that setting goals for increasing diversity spending becomes almost impossible when you have no benchmark to work from. So there's all of these challenges. And then we throw in the wild card. In healthcare, this is particularly important because everything we're talking about is directly related to health outcomes. So beyond the social impact of what diversity brings, we're talking about economic ramifications of having a robust, agile supply chain. This also has to do with actually keeping people healthier and living longer and having better lives. So it's both exciting and humbling when you look at it from that point of perspective, where we're talking about social determinants of health and things that actually truly matter. So I'm very excited that you have a few minutes to spend with me today, and looking forward to having this conversation about strategic sourcing for impact. Now, that said, a little bit about me, and while I'm even talking about this, I'm Ade Sholaru. I'm CEO at Supplier Gateway, and really, my passion has been in the application of technology to address practical problems. I started in aerospace manufacturing about 400 years ago. I'm building things. That's what I really enjoyed doing. And during that time, I was fortunate to be exposed to procurement management and supply chains. But interestingly, without the technology that we actually have today. So it was all the old school stuff. Fortunately, I got to be part of a lot of cool stuff in the world of tech throughout my career. I worked on projects at NASA on, computing of the future. Back then, it was like Mosaic before it became Netscape, before it became obsolete, I guess. We looked at quality management principles at different R&D labs. We created a secure data access network for transmitting weapons systems data, which sounds as ominous as it was. But really, there we got to experience what it's like to really secure information that was important, but distribute it via the web. And then finally, we figured out ways for companies that are sometimes competitors to actually collaborate on supply chains, to share suppliers and networks of suppliers, which actually became what you know today as Supplier Gateway. So it's been an interesting journey that gets us here, but it threads in technology, supply chain management, impact, and some of the other cool stuff that we're going to be talking about today. So really excited. On our agenda, we have some very specific things that I want to make sure we cover in the next 35, 45 minutes or so. The first is really specific to the challenges of achieving supply diversity for yourself, not in an altruistic sense, but as a practical top line or bottom line imperative. We're also going to talk a little bit about building a resilient, diverse supplier network. So we're not talking about business performance. This is probably one of the last times in this webinar that you're going to hear me mention, diversity exclusively by itself, because it turns out, probably no surprise to you, that supplier diversity is simply a building block for doing better business, just like raw materials and, processing and transportation and all the other inputs for your business or for your organization. And then last, we're going to talk about driving impact with Supplier Gateway, because someone has to pay the bills. In this case, it's us. But seriously, regardless of which tools you use, whether it's Supplier Gateway or anyone else, I think the ideas that I'm going to show you in our platform can hopefully inspire you to look closely at how you're approaching this mission and give you some thoughts about how you might want to really optimize your diversity and agility in your supply chain. Now, a bit of housekeeping before we get started. If you have questions, and we're all pressed for time, do not wait till the end. There's a chat button at the bottom of your screen, or a Q&A button, I'm sorry. There's a Q&A button at the bottom of your screen. Click on that, ask your question, and we have moderators who can actually answer your questions as we go. So you don't have to wait till the end. Okay? All right. So let's start with, talking about the challenges of achieving uh, supplier diversity. So there are some common misconceptions. I mean, obviously there's challenges, but there's also some misconceptions, especially within healthcare sourcing. So one of them is the notion of a limited availability of diverse suppliers. And we know that, finding diverse suppliers that can meet your specific needs, such as high quality medical supplies, pharmaceuticals, services, that can be difficult. And it a lot of times it's because the smaller scale of diverse suppliers compared to larger counterparts makes that a bit of a challenge. Now, there are some misconceptions that go with this. One of them is around quality. Products and services from diverse suppliers may be of lower quality. That's a hangover from, I'm not sure where actually, but the reality is diverse suppliers can offer products and services that meet or exceed the quality standards of non-diverse suppliers. There's just empirical evidence for this. And some of this might be because for diverse suppliers or smaller suppliers to be successful, to differentiate in the marketplace, they have to work just a little bit harder. The benefit to you as a healthcare organization is you might actually be accessing, quality product at a competitive and aggressive price, because that's another misconception. The notion that, a diverse or small supplier is more costly. Um, in the initial integration of the supplier into your supply chain, that possibly might be true because a smaller supplier may not have all of the connection points into your healthcare organization that some of the larger, more established players can. But over time, you'll find, I suspect that, fostering a diverse supplier base can lead to competitive pricing and innovation and improved service, especially because just the inclusion of the smaller and the diverse supplier into your product mix, it creates more competition. So it might even make your incumbents a little bit better in terms of how they provide services. Second area, streamlining procurement and integrating diverse suppliers into your existing supply chains. And I alluded to this a little bit earlier on. Healthcare, as we know, is incredibly regulated. And there are lots of things you think about before you engage a supplier. And diverse suppliers have to comply with numerous health and safety regulations. As a matter of fact, all suppliers have to do business with healthcare. And that might be OIG or excluded parties lists, or things that would cause your organization to not be reimbursed because they're on a Medicaid sanctions list, or the suppliers need to be credentialed, and those credentialing criteria are very specific, and so on and so forth. So managing compliance is challenging for any business, could be possibly a little bit challenging for smaller or newer companies, but a lot of this is being mitigated through the use of technology platforms like ours that help to monitor your supply chain, try to identify any risk points, try to give you early warnings, and so on and so forth. So it's generally good business to stay on the right side of the rules anyway. So it's no different for diverse suppliers, and they understand, diverse and small suppliers understand that these are the part of doing business, and they're prepared to absolutely step up. In terms of integrating into your supply chains, really, it could be because with the existing organizations that support, healthcare organizations right now, you have all of the standard connection points, and they do it for lots of organizations. So, overcoming this might be really more of changing the mindset of the folks inside your own organization, because the diverse suppliers, the small businesses, are ready to step up and get that done. They have the capacity, they have the personnel, they have the expertise, but what they really need to do is to overcome the perception that they're not able to. So a little bit of experimentation in some cases. It might depend on which commodities or which categories you start with. And then as you have more success stories, it makes it possible to really use those as levers for the future. And then, of course, scale and capability. Are diverse suppliers too small to meet the demands of a large healthcare organization? Sometimes true, but that's also true of any small business where you're trying to really take advantage of their innovation, their responsiveness, how agile they are. You may run into challenges and issues as it relates to scale. And there, it's really about being a true partner to those organizations, understanding what their limitations are, and trying to work with them to understand how much can we ask of you that won't break you, but will help you kind of grow and achieve really a level of capability that we're looking for. Last area is around maintaining cost competitiveness. So, competition is competition, right? So financial aspect of competing with larger suppliers, they have economies of scale. That can be daunting for smaller and diverse companies. Suppliers might have challenges with things like access to capital, resources, and I just mentioned scale just now. Growing is hard because growing means that you have to deal with some of the economic challenges associated with becoming a larger company and having more capacity and having more employees and all of those things. It's difficult for any business, a diverse business. There's sometimes even more challenges, but there's lots of organizations that are stepping up to try to address that. It might be some of the minority, women, LGBTQ, veteran business councils. It might be government agencies and so on and so forth. It might be financial sector providers who are realizing that this is an opportunity to grow the economy overall. And so, yes, there are barriers. Yes, there are challenges, but there are lots of people who are actually stepping up. So this is not completely a technology thing. This is really an awareness response where this notion of scale and capability is being addressed directly with folks and organizations who are saying, we think we have the appropriate interventions to help try to create more bandwidth and create more opportunity for smaller businesses, more diverse businesses to grow. And that's, I think, overall a bonus for organizations like yours in healthcare. So lots of people understand that there is a challenge and are stepping up to try to help you build that resilient and diverse supplier network. Now, my conversation today is going to be around technology specifically. And I really wanted to look at these 5 areas, starting with, the utility or utilizing advanced tools for filtering and figuring out who's actually out there so that I can identify and bring diverse suppliers into my supplier mix. I would strongly recommend that you use supplier discovery platforms. Supplier Gateway is a supplier discovery platform, amongst other things. There are other platforms out there, but generally what you want are tools or platforms that allow you to filter, search, identify suppliers, not only based on their capability and diversity, but as well as their location, what industry are they in, and then when there's the possibility of having some reputational risk with, relying on the information, you might want to look for certifications. Are you certified, or do I have to just take your word for it? I would lean towards some form of certification or attestation so that you have a high level of confidence in what you're looking at. You for sure want to leverage data analytics. And again, there are tools that help you assess, quantify, potential diverse suppliers that might meet your specific needs. You want to use business intelligence software, and this is really where you're now analyzing supply chain dynamics. There's lots of different organizations that help with just getting business intelligence in general. So in healthcare, you might belong to a GPO. One of the things that GPOs I know offer, we work with several of them, are the access to business intelligence about possibly looking at your sourcing profile, identifying areas of opportunity to utilize local, small, diverse businesses. I would leverage as much of that as possible. And if in your own toolkit, you're able to run some of those analyses on your own, like you can in Supplier Gateway, that's just more ways to figure out how to really increase the utility of diverse businesses. I have a note here that I wrote to myself earlier about exciting thing called AI, because there's AI-driven solutions. At Supplier Gateway, we're actually going to be introducing an AI intelligence assistant over the next few weeks. I don't want to preempt our own announcement, but it's appropriate time to mention it. And what this allows us to do is to really deploy the artificial intelligence tools to start to automate the identification and qualification process, to look at how you analyze the vast amount of data. We have almost $10 trillion worth of data of transactions and relationships and interactions over the last 25 years. And AI is going to allow us to bring the value of some of those insights to you as you're trying to make decisions about how do I optimize and build my resilient network to be inclusive and to be supportive of my community that I serve, and so on and so forth. So lots and lots of cool technology. Next, we want to talk a little bit about working with diversity databases. And I know in the supplier diversity space, that's the first thing you do. Oh, I'm going to need to have access to a database and integrate into it. Um, by all means. Now, one of the great advantages of platform technology is rather than having to have a hodgepodge of different sources of information, there are platforms that are now really mass aggregators of data. Supply Gateway is one of those. And this is really about how do I synthesize information from lots of different places into kind of a single place where I can look at it and get a true sense of what a company is, what they're able to do, who they've worked with, who are they certified by. All of those things have always been important, but they've been difficult to actually execute properly because the technology simply wasn't there, like when I was in procurement 1,000 years ago. But now there is this ability to have kind of a single view of a supplier from their diversity, their capability, their location, even their risk. Things, every new supplier relationship represents a risk proposition. Every supplier represents risk. There's upside too. And so when you're looking at a diverse supplier, looking at a local or a small supplier, in normal supply chain speak, you're simply looking at a supplier who happens to be diverse. So you still have to manage all of those other things. So making sure you have access to that data, making sure that data is available to your internal tools. So we're now talking about how do you synchronize that with your internal ERP or your AP system? How do I make sure that as things are updated, that information is available to me so that when I make my purchasing decisions, I'm making it using the latest data? How do I mitigate risk from audits? If I report to, say, a government agency, or if I have to document my subcontract plan management, how am I sure that the information that I'm presenting is actually accurate and it's not going to get us in trouble? So those are really all facets of how technology not only helps you to identify the diverse suppliers, but as you start to engage them, it keeps the diverse suppliers as a positive contributing asset to your organization rather than a risk or a liability. Um, Supplier registration portals, you're not going to be surprised. Supplier gateways are supplier registration portals, but regardless of who you use, it's very important that you're collecting as much information that helps you make that determination as to whether a supplier is fit for the purpose. And that is not only are you certified, but also other demographics. Are you minority? Are you a woman? Are you a veteran? If you can capture information about ethnicity, especially if you are in a particular location where there are high sensitivities to demographic inclusion for specific categories of companies. A lot of times this information is not in the public domain. It's not on a website somewhere. It's not written down somewhere. So you actually have to ask. And so it's very important that your tool, whatever registration portal you're using, is able to capture that information. And then again, all that other stuff that goes with it. I want to verify that your tax ID is valid. I want to make sure that you're not on the OIG list or the excluded parties list or on a Medicaid sanctions list. Why? Because it's okay that you're a diverse supplier. I'm super excited that you do something that may be able to help our healthcare organization. But at the end of the day, I'm going to still need to pay you. And if you're on the Medicaid sanctions list, that's not going to happen. So the idea is whatever tool you use needs to be able to help you address those challenges as a seamless part of the experience. But that's where you're really going to get the leverage. Only a couple more of these to go. One is analytics and reporting tools. So we're talking about dashboards, and sometimes dashboards are to help you really understand the picture of what is going on. Sometimes the dashboards are to help you tell your story better internally in the organization as well as outside of the organization. And so they can be informational, they can be analytical, they can be persuasive, where you're trying to show we have actually been making progress year over year in our engagement of minority, women, veteran, local, small, LGBTQ organizations. And as it relates to our catchment area, we're talking about healthcare, right? So the people who come to your facility for healthcare are people who generally live in your community. So you care about them, you care about the impact of having people in your catchment area coming in. You care about the economic impact of your behavior when it comes to how you engage them. And you want to be able to speak to, the city council, your stakeholders, the people who are invested in the success of your health system, you want to be able to speak to them in a language that is backed by empirical data. And that's where the analytics and reporting tools come in. And again, that's part of how, once you've identified and engaged these suppliers and you're starting to use them, you're able to report, you're able to do economic impact presentations, and then you move to the next level, which is predictive analytics. How do I actually move the needle? Which areas do I need to focus on? Which types of suppliers do I need to engage in my supplier engagement practices and onboarding practices so that I can create the results that I seek? So tools can help you do that. And you can, essentially do more with less, which is what we're all being asked to do. And then last, but certainly not least, everything is about collaboration. And so I'm a big proponent of collaborative networks and partnerships. Even though Supplier Gateway itself is a software as a service platform, a lot of what we do is talk to and work with organizations, industry consortia, advocacy groups, agencies that exist really to try to create more avenues to leverage your interest in engaging small, diverse local suppliers. And their basic contribution is they represent knowledge, resources, grants, best practices, just forums. Sometimes getting into a room with a bunch of people who have similar challenges as you is absolutely an incredible way to increase your own knowledge of how you can leverage the technology to achieve what you want. And sometimes it's, people in the same industry. So we might be talking to people in healthcare. Sometimes it's people in different industries. So using Supply Gateway as an example, we have healthcare, real estate, and I know healthcare organizations use a lot of real estate. We have construction. Healthcare organizations are always building something. As a matter of fact, I think in every community where we have a healthcare client, there's always a tremendous amount of construction. And construction is one of those activities where you can have direct economic impact on the local community because you employ people and you employ firms that employ local people who can then afford preventative healthcare as opposed to emergency care that can enter into wellness programs. And so this goes back to those social determinants of health that I mentioned at the very beginning. So again, even though this is a conversation about technology and it's a conversation about resilient and diverse suppliers, it's also very much aligned with what I understand to be the objectives of most healthcare organizations, because most healthcare organizations that I've met and I've talked to want to keep everybody healthy. And I love that fact, and I'm very grateful for that. Now, one of the things that I wanted to mention before I went into the demo was I wanted to talk a little bit about one of our clients who's also in healthcare that had a very specific idea about what they wanted to do. They really wanted to leverage technology to start creating some real economic impact. And they set some very clear goals. They said, first, we're going to use this tech and we want to see what we can do about increasing diverse spend. And, early results, 52% year over year increase in diverse spend. They're not only focusing on spend, but it's a metric. And, as they say, what gets measured gets done. So they said, wow, we're able to increase diverse spend. Now we're looking at how can we make sure that we're maximizing economic impact? How can we make sure we're maximizing the creation of jobs, the creation of economic growth? Because economic growth is what makes it possible for people to really be in good stead and able to pay their bills. I mean, that's the nature of things, right? But as I said at the beginning, it's not only always an altruistic thing, it's actually just good business sense. So it turns out that creating diverse supplier networks, resilient networks. We discovered that during the COVID pandemic. A resilient and agile network sometimes means, do I have a source that is close by that is not going to get interrupted by the fact that suddenly I'm unable to receive shipments of things and so on and so forth. I don't like to think about the world in catastrophic terms, but that was an object lesson in these things can happen, and when it does happen, what do you do? And I think we've learned a lot, and the impact and the importance of diverse and local and small and resilient suppliers has increased manyfold since 2020, 2021. So lesson to learn there about, again, the value of your diverse supplier network. So Wellstar, hopefully we'll have more to report about them and others like them who are achieving incredible things with technology and their supplier diversity. So I'm going to spend the next few minutes just talking a little bit about driving impact with the Supplier Gateway platform specifically. And to understand kind of contextually what I'm going to talk about, I just wanted to tell you a little bit about what's in the platform. We have a comprehensive suite of supplier data solutions. I'm not going to spend a lot of time on each one. I'm going to focus today on diversity and in our diversity platform, we have tier one, tier two, compliance related stuff, data enrichment, all of the traditional things, and you'll see a little bit about what we have there. One of the other areas that we're finding there's a tremendous amount of interest in is around sustainability, because in many healthcare organizations, the team that is responsible for supplier diversity is also being asked to step up and also be responsible for sustainability, or vice versa, or there's a synergy between the two. And of course, sustainability has, again, gone beyond being a conversation about how we're going to make the world a better place, because it is about how do we make the world a better place. But there's now another impetus for it. There are actually changes in laws. There are compliance pressures. I know that the SEC for publicly traded companies now has new requirements that are going to be impacting anyone that's subject to SEC regulation. I know that in healthcare, I think it's scope 3 emissions, which is greenhouse gases. Scope 3 being emissions and things related to GHG that are from your suppliers. So once upon a time, you had to worry about yourself, which is scope 1. You had to worry about the stuff you use, which is scope 2. Now you have to worry about the people who provide services to you and are part of your larger ecosystem, which is scope 3. And so we felt that it was very important that as a one-stop platform for supplier information management, we really were able to address this. So we have some really cool stuff that I'll show you in a little bit. Of course, onboarding is part of what we provide as a solution provider. You found the diverse supplier, you've identified the fact you want to engage, you have to onboard them. And I talked about risk earlier on. The onboarding process really is a compliance and risk management activity. Do you have all your paperwork straight? Do I know how to pay you? Have you attested to all the things I need? Have I credentialed you properly so you can physically come into our facility? Am I monitoring you for risk? Are you on the OIG list? All of those things are part of onboarding. Not tangentially related to diversity, they're directly related to diversity, because all diversity is about suppliers and all suppliers are suppliers. So anything that applies to a non-diverse supplier applies obviously to a diverse supplier. And so we want to make sure that you have that capability. And of course, if you needed everything, which many of our clients do, you could get an enterprise bundle. But this is not a sales pitch. I wanted to talk a little bit about what we do. And to do that, I was going to do a quick demo. I wanted to give you a few minutes to take a look at some of the tools around diversity, sustainability, onboarding. I know that when you take a look at what I'm going to show you, you're probably going to want to talk about it some more. But Leanne, who's organized this webinar, has told me I cannot talk for 4 hours. So you have the opportunity to schedule a demo, and our team will be more than happy to go into any amount of depth that you want on any of the functionality I'm about to show you. But we'll just spend a few minutes taking a look at some of the diversity, sustainability, and onboarding tools, just so you have an idea of how this technology is being leveraged today on the Supplier Gateway platform. So let's go take a look. Okay, so let's take a look at some of the tools. Now, forgive me, I'm supposed to be making eye contact while I'm doing this, but I'm looking at another screen. So I'm not ignoring you, I'm looking at the other screen. I haven't quite figured out how to do this without looking away. In our platform, the first thing you'll notice is there's as many variations of our platform as we have clients. And really, we consider it a very important part. So this is kind of a basic Supplier Gateway look with One Health System. You can start to really personalize your platform by changing images, branding, the words that are on there. And then if you really want to go to town, you can do what some of our other partners have done. This is, I think, our folks up there in Oregon do this. These are our friends in the let's see, this is more Hennessy. And in each case, what you'll notice is this kind of ties into their brand. And a lot of what they're trying to do is to make sure that they're being very clear about their commitment to inclusion, equity, diversity, local business engagement, impact on community. And your platform is actually available to help you do that. So beyond the technology that engages, helps you with sourcing, helps you with analytics, and so on and so forth. It's also a very important part of how you message about what you're trying to do. And it doesn't necessarily always have to be about diversity. In this particular case, it's a global implementation that has to do with engaging suppliers in general, inclusive of supplier diversity. So all industries, all types, but in all cases, what you're looking at are organizations that are really getting their message out as part of that supplier interaction and supplier engagement process. I'm going to go into one of our sites here, and I want to start with supplier diversity, which is one of the areas that I pointed out earlier. And where most people start is around money. And so we're going to go take a look at, whoops, that kicked me out because, of course, I had it open too long. So we're going to go take a look at this information about money. So I'm going to make a selection. And this is a great thing about analytics. All of the money that the organization has been spending can be categorized, filtered, analyzed, and looked at and sliced and diced a million ways. So a lot of what you're trying to figure out is how much have we spent? How much did we spend with diverse companies? How much were with veterans and women and minority and service disabled veteran and small and LGBTQ? Who were the top companies that we spent money with? And where were they located? And which classifications do they fall under? And if you have an organization that spends money outside the United States, it might be in other countries. Almost every client we have has that scenario where they actually deal with suppliers from all different parts of the world. So this is actually a global tool disguised as your supplier diversity platform. And then things like I care specifically about certification. So I want to look at certifications. I want to know what we've done on a rolling 5-year basis just to see is our program growing? Is our program getting smaller? And depending on what the start point. So let's take a look at what this ultimately renders. It says that our program is, there we go. We started our program in 2019, and then 2020, it really started to take off. 2021, it really went through the roof. So we're doing something right, and that's maybe important to stakeholders. Or sometimes you have to slice and dice and do analytics and answer very specific questions. We have ad hoc tools. Or over here, I have our stakeholders are asking, what has your impact been in our community in terms of things that people want to talk about all the time? So this is an election year, and this is something people talk about all the time, right? Jobs. How many jobs have been supported? What is the total compensation? What's the value add? What's the output? Can you tell me the demographic breakdown of all these things? So of all these jobs that have been created, how many as the result of our engagement of minority-owned business and women-owned? All of those things are real and pertinent questions that stakeholders will ask, and they will ask that question at any time of day and night. And the important thing is, rather than you having to do a science project to get the answer, you can log in, identify the scope, which classification, which group, which part of the country or which part of our region, generate those reports. And then when you need to deliver it to those stakeholders, so let's say I need to do an executive briefing. Now I'm going to create an executive briefing report. It pulled all of that information that we were looking at earlier, which is, if you give me 1 second, we have content, we have report criteria, what's in here. We have some pre-filled qualitative narrative, but you can edit any of this and tell your own very specific story about what you did, what you are doing, what you're hoping for. You can change any of these images at any time. I'm going to do that right now, actually. And let's just say the way I want to send this message, I want to have a different image because it needs to be more akin to health professionals. So now I've changed the image. So, they're neat tools, but really this is more about how can I take the technology, the information, the analytics, the intelligence we derived from knowing many things about many people and what they are, and how can I turn it into something that can actually support the message that you're giving to your stakeholders so that you can communicate properly the impact that you're having. Of course, you can download it, print it, save it, use it again at any time you want. So there are tools for understanding your spend, slicing and dicing your spend, um, communicating your spend, and not only on the tier one level, there's tier two, and tier two programs are becoming increasingly important because you're asking the suppliers to your health system to respond to essentially what information do you have available. And I've got a lot of spend information, so this might take a second. So we're looking at tier two reports and information that have been submitted by your primes. We have kind of a way to look at tier two that is somewhat unique to Supplier Gateway, but it's really intended to try to have you use economic or financial principles in looking at a return on investment. So for every dollar that I spend with my prime supplier, how much tier two impact are they having? So that I can almost look at it from an ROI perspective. It's what allows you to normalize information about some of your very big prime suppliers versus your smaller prime suppliers who may be doing quite a heavy lift, but they don't normally get recognized because it's on total dollars. But what they're really saying is, for every dollar you spend with me, I'm really doing my best to try to support really the premise behind more inclusive procurement, more local procurement, more small procurement, and so on and so forth. So there's a way to actually look at that information in your dashboard. We also cover other aspects of tier two. There's project reporting when you have specific projects. There's subcontract plan management. I think at the very beginning, I'd mentioned that healthcare has lots of construction, and most times when there's construction projects, you're looking at multi-tier reporting where you're now looking at a particular project where you want to track all of the spend on a project where there might be 1, 2, 3 tiers of spend, and you want to capture all of that diversity impact on all of the tiers. So this allows you to actually manage those types of projects in the tool, multiple projects, multiple levels, multiple prime contractors, general contractors, subcontractors. All of that is part of the standard supplier diversity tool set. Data enrichment is another thing that I know that if you're in supplier diversity, you've probably heard of, I need to do a data enrichment. In Supplier Gateway, with our platform, data enrichment just comes with it. When you load any supplier information into the system, when you put your suppliers in, we will go to work trying to enrich that data. And we use not only data that we've collected over the last 27 years, but also data that we collect every day from registrations that people come into our tool, as well as data that we source from third parties, cities, states, federal government, databases, all of those different sources of data where, remember I said earlier, I'm going to go out and look for databases. What we've decided at Supplier Gateway is we're going to bring all those databases here to you so you can go to one place and get all that information all at once, and then we'll use it to enrich your data. So while I'm here, I know I'm getting a little bit long in the tooth, there's lots of other tools. We're going to skip those. We're going to go down to sustainability reporting. And I wanted to just give you a quick glimpse at the sustainability tools. I'd mentioned greenhouse gases and some of the other assessment types. I know that we have, let's see, we've got supplier ESG, which is really understanding the ESG commitment and risk levels. We had GHG leadership. GHG stands for greenhouse gases, and this is your emissions. And this is the scope 3 that I mentioned had to do with suppliers' emissions and really getting an assessment of what they're doing. There are also assessments for supplier D&I, which is really assessing your supplier's D&I practices beyond, their spend. The spend is simply the empirical data around what have you spent and who with, but it's also asking about their practices. Do you have programs in place? Do you have policies, and so on and so forth? And then, of course, human rights compliance assessment is another one of the assessments. And what you can do is you can ask any one of your suppliers to complete 1, 2, 3, or 4 assessments, and those assessments form really the ability for you to see them in a different light. So before you were looking at their diversity practices in terms of spend. Now you're able to look at them in terms of these compliance areas. And I'll give you just a quick glimpse. I think for Fullerton General Contracting, my example here, I've asked them to fill out 2 assessments. They've completed one of them, and the other one seems to still be in progress. So let's take a look at the one that they have completed. It's a sustainability assessment, and it's got every assessment has a report for each one, and then there's a combined report. So if you ask for 4 assessments, it'll actually give you a report that has all 4 in when all 4 are done. And in each case, this is, print ready so that you can distribute it, and it has information about how the assessments are organized, what are being measured, and then what the actual scores are for this specific supplier. So I'm just going to scroll down a little bit here. So this is environment and social governance, greenhouse gas leadership. So things that are in GHG, before we get to the result, emissions, emissions methodology, general information. So there's lots of questions, and this particular assessment is used by our clients worldwide. So part of what we're trying to make possible for you is that you can have almost an instant on sustainability capability that allows you to start getting a bigger picture view of your supply chain, so that rather than guessing as to what's going on, you have empirical data, and that empirical data allows you to start making some decisions and putting together some plans for how you want to manage your suppliers. And then, of course, when you have enough assessments in place, you can start doing more analytics to say, of our suppliers, how many of them are in the red zone, in the yellow zone, or in the green zone when it comes to different assessments. I don't have a lot of suppliers right now, so that's why my numbers are a little bit low. But you can imagine that as you start asking for more and more assessments and the suppliers complete them, you start to have a bigger and better picture view of what's going on in your supply chain. So I covered tier 1, tier 2 data enrichment, diversity assessment, sustainability, and some of those things, all in one turnkey package. Now I want to talk a little bit about the onboarding process. Really, the onboarding process is all about how you get suppliers to come into your system and provide the information you need to engage them. So in each organization's case, it's a little bit different. You send the invitation using your methodology, and what generally is going to happen is, let's go take a look at a couple of examples. So in this example, this is a case where, there's lots of questions being asked: products, services, ESG, payment, banking information, anti-bribery, web accessibility, and so on and so forth. All of these are things that each client ends up configuring to identify what they want. In my test site here, I have W-9, got to get a W-9 because we got to pay them. Insurance and bonding, because in order to come into our facility, you have to be bonded, or you need to be carrying a certain amount of insurance. We have to be a named insured for our health system. You can get certified with our EDC. We can look at the certifications area. At the beginning, I had mentioned that one of the most important things is, ask questions on the way in so you can know things about your suppliers. So I need to know all of the different types of certifications you have. And there's lots of different kinds. There's diversity, there's quality, there's sustainability, there's transportation. And then around diversity, all sorts of different types. Do you have county agency, federal agency? Do you have NMSDC, WeBank? And so really, as being that mass aggregator of information, it makes it possible for us to help you really get the biggest picture view. So you don't have to go to Cook County to know their Cook County WBE. You don't have to go to NMSDC or you don't have to go to WeBank. All of that information the suppliers are able to provide during their onboarding and registration process. And then ultimately, that gives you the opportunity to really take advantage of that data. And with that data, when you are running your data enrichment, or when you're simply doing your spend analytics, it's drawing from all of this information that we're able to collect. And that same capability for diversity is obviously going to be applied for things like, I also now want to see my minority, women, and veteran-owned suppliers that also are certified by one of the sustainability certifying organization, like EcoVadis, for example. So there's lots of different ways that this information can be useful to you. But one of the things that is instrumental is we make sure that we ask these questions on the way in so that you have the information that you need to get the job done. So we have tools to help you with your diversity, tools to help you with your sustainability, tools to help you with onboarding and compliance and risk. And all of that adds up to really fundamentally an environment that gives you the ability to really leverage the technology to create those sustainable, diverse supplier resources that you're looking for. So I know I kind of went through that at 100 miles an hour, and there's a lot there, as you can tell. But really, you do have the opportunity to get a demonstration of this in depth. And to do that, I'm going to show you a little bit of information that will help you get there. So as I said, anything that you need to see in depth and not at the breakneck pace that I just went through it in terms of the demo, suppliergateway.com, click on the book a demo link, and one of our team will be more than happy to spend some time with you answering every question you possibly could want. I'm sure the Supplier Gateway platform can help you achieve, really the resilient and diverse supplier network in healthcare that you are looking for. I really encourage you to check out that website. Please book a custom demo for your own organization. And remember that a recording of this webinar is going to be sent to you. I know we covered a lot today, but when you get that recording link, watch it again, send it to your colleagues, and hopefully there's an opportunity either to learn how the Supplier Gateway platform can help you, or just an inspiration for figuring out how to make whatever your existing tool set to be more effective for you. So thank you again. Thank you for your time today. Take care.